Hello everyone, I'm Jeff DeSantis, and today I'm going to show you how to enhance your clinical experience using ASA MD. You'll see what I'm talking about. In our office, what we do is we have a face sheet printed out for the patient. I look at the face sheet, locate the patient, find them on the schedule of the ISA MD, click on that patient, and then hit the record button as I walk into the room. The nice part about this is that I do not have to perform any writing, looking, or typing while I'm seeing the patient. It's called ambient AI, is how it's used, and it's pretty unique. When I start with the patient, I say, "Hi, I'm Dr. DeSantis. I see you're here today for left heel pain." How long has it been going on for now?
I'd say like a few months now, about 3.
Okay. Any history of injury?
No.
Okay, good. Has there been any swelling or bruising?
No.
First couple steps out of bed in the morning get you though?
Yeah.
Okay, sounds good. Otherwise, any medical conditions I should be aware of? All right, okay. So on physical examination, obviously we have a sample patient here. We can see neurovascular status is intact. Dorsalis pedis posterior tibial pulse is 2 out of 4. Capillary leafo is less than 2 seconds. She has pain with palpation localized to the plantar medial heel on the right. Okay. No significant equinus is noted with the knee flexed or the knee extended. There's no edema or ecchymosis noted. At this time, I'm going to order an x-ray through my MA. At that point, what I can do is I can hit the stop button, okay? And this time I will order the x-ray. My x-ray tech will take the x-ray. I will walk to another room, see another patient. When I come back, we can have the x-ray on the screen in the room. And at that point, I hit a button. You'll see here on the bottom here, 1 sec, as it's regenerating. It's actually making a soap note, which you'll see in a minute. That's all done, but I can add to that soap note. There's a button on the bottom left, as we see right here, which says regenerate with additional information. Okay, so I'll click that one. And now I will explain to the patient, we've taken an x-ray and I'm going to dictate the report as we're speaking to you. It makes a full x-ray report. It's really cool. It's much different than the x-ray reports, findings you'll see in a normal. This is a full x-ray report that we spent a lot of time working on. So basically, if I look at this, I say insert template, x-ray report, 3 views, foot right, AP-MO lat, reveals inferior calcaneal spur. There's no fracture or dislocation noted. No soft tissue mass is evident. No cortical periosteo reaction present, period. So our diagnosis is, I tell the patient, you have a heel spur there. I don't think that's what's causing your pain. I think you have plantar fasciitis and pain in the left foot. For that reason, we have a couple different options. As we talked about before, you said you were averse to a cortisone injection, so we're not going to talk about that. What I am going to recommend is that we refer you to physical therapy, and then we will pre-certify custom orthotics for you, and then I see you back in 3 weeks. Okay? Then what I do is I hit the stop button at that point. Okay? The patient can go to the front desk, or the MA can come in the room, make the follow-up appointment. The note is regenerating right now, as you see. This is a sample patient, as that's my wife's name on there, so there's no HIPAA violation. We have her permission. And right here, there's a transfer button to EHR. But if you see there, I did no typing at all. There's a summary on there, a subjective findings, objective findings, assessment plan, separate x-ray report with our diagnosis codes and procedure codes available. We prefer to enter those separately. So what I do for our workflow is I finish this up. If I have a break in between patients, I will do that in between patients. Most commonly, I will do it at my lunch break or at the end of the day when I will review the note that's been transferred to Athena. I will enter the charges and sign off the note. I figure normally, I've actually timed myself to this. It takes about 30 seconds per note for me to do this. The notes are so much better than what I ever did before, believe me that. And I think doing it this way, you get a better note, okay, definitely. You're saving a significant amount of time. I save about an hour a night if you're seeing anywhere from about 40 to 50 patients a day. If you save a couple minutes per patient, you're gonna save about an hour at the end of the day doing this. So it's worked out really well for us.